80s and 90s, corporations really started to understand how helping their employees and their employees' families with mental health struggles or substance abuse struggles could improve the functioning of the organization, the effectiveness of the organization, the productivity of their workforce. And so EAPs serve both the little client and the big client, and it's really a win-win for both.
Hello, and welcome to the Mental Health Advantage podcast, where HR, benefits, and total rewards leaders explore the future of workplace well-being. I'm your host, Stephen Sokoler, founder and CEO of Journey, the leading proactive mental health solution for modern companies. Today, I'm honored to be joined by Dr. Randy Martin, Clinical Director of the CopeNYP Employee Assistance Program at Weill Cornell Medicine. Randy is a psychologist, healthcare executive, and expert in EAP, suicide prevention, and inclusive mental health, with over 36 years of experience across clinical and organizational settings. Did I get all that right, Randy?
Yeah, 40 years now.
Here you go. All right. I didn't want to sell you short. All right. Well, let's hop in. So, Randy, you've worked in community clinics, major corporations, academic hospitals. What keeps you inspired to continue advancing mental health access and support?
I was originally personally inspired by my family. My mom was in therapy. My sister was in therapy. And I saw how it helped them and how it made a difference in their lives. And I sort of had a natural bent towards, caregiving and helping and that kind of thing. So sort of started there, the interest, and then was a psychology major in college, and then decided to go into counseling psychology as a master's and then a PhD. And counseling psychology was interesting to me. It's a little bit different than the field of clinical psychology because counseling psychology started from a different standpoint. It was working with children and adolescents and families and in outpatient settings as opposed to inpatient. So the roots of clinical psychology were really in inpatient settings in mental hospitals and asylums and that kind of thing, with very deeply disturbed patients with schizophrenia and these kinds of things. Whereas the counseling psychology field came more out of helping what we now call kind of the worried well, which is people like you and me who are out in the world and may need some outpatient therapy to feel a little bit better, but aren't suffering from deeply significant mental health issues that cause you to have a hard time working or relating to others, things like that. And so I really enjoyed the idea of working with people who were suffering from problems that derive from the stresses and strains and hassles of everyday life. And that kind of describes the American employee, right? And all of us who are out there just dealing with the normal stressors that come with a combination of work life and personal life. I also I developed an interest in positive psychology after I moved out of 18 years in community mental health and started in the employee assistance program field. I started to learn about the nascent field of positive psychology. It started in 1998, 1999 by Dr. Martin Seligman at the American Psychological Association. And he similarly noticed that the field of psychology was really focused on really impaired people and bringing people from significant mental illness to sort of baseline so that they could live a normal and productive life. So it was about remediating pathology, and that's fine and that's great. And that's the first 100 years of psychology really focused on that. But he said, it's time for us to really look at people who are thriving and flourishing and doing well in life. And what's different about those people? What's different from a genetic point of view? What's different from a learning point of view? From a trait point of view, and from the way that they think and the things that they do? How are they able to negotiate the world without developing really significant mental health challenges, substance abuse challenges, and things like that? So started to really look into positive psychology and was fascinated by it. As I started working in the employee assistance program field, where I've been for the past 22 years, what I really noticed was that the mental health system in our country is broken. and it doesn't really do people a service when people are trying to find help. It's quite difficult for them to navigate the insurance and the availability of clinicians and what kind of clinician should they go to, and even finding a clinician who will take their insurance and all of that. And being part of the employee assistance field was very fulfilling for me, because what EAPs do is provide free counseling to, no cost counseling to employees and their household members. And this is a great way for people to start their mental health journey. And it's paid for by the employer, and it's short-term counseling and then referrals to longer-term care. And one of the things that EAPs do to help the broken mental health system in this country is that once we do the short-term counseling and we determine that you could use longer-term care or higher level of care or medication evaluation and management, we'll help you find someone who takes your insurance and who's available. And that's a really hard thing for just a regular layperson to do, but it's pretty easy for us to do. And so we basically act as kind of I don't know, sort of a coach in terms of getting you into the right hands for longer term care. So I think that's great. A great thing about the EAP field, and the it's heartening that corporations and nonprofit organizations and educational institutions virtually all have employee assistance programs or student assistance programs available now that are free entry into the mental health system.
I agree with that completely. Um, tell me your thoughts on EAP. You've obviously been in the space for a long time. How have you seen it evolve over the last, whether it's few years or decade plus?
Yeah. I mean, EAP is really, really interesting because you have two clients that you're serving. You're serving your individual clients that you see for individual counseling sessions or couples counseling or family counseling. But then your other client is the organization. And organizations have, over the past, since EAPs really began in the 70s and 80s and really took hold in the 80s and 90s, corporations really started to understand how helping their employees and their employees' families with mental health struggles or substance abuse struggles could improve the functioning of the organization, the effectiveness of the organization, the productivity of their workforce. And so EAPs serve both the little client and the big client, and it's really a win-win for both. And one of the books that I sort of think about when I think about that is Sean Akers' book, The Happiness Advantage. Yeah, he talks about how employees who are mentally healthy bring so much more to the workplace. They're more creative. They're more productive. They get more promotions. They sell more stuff. There's just so many metrics that show that if you have a contented workforce, that you are going to have less turnover and better retention and less absenteeism, presenteeism, and improved aspects in so many different ways. So it's been great watching corporations sort of really grow in their understanding of the vital central importance of mental health, not only physical health. They have to have physically healthy clients, employees, sorry, but they also have to have employees who are able to negotiate the daily hassles of life effectively. And employee assistance programs and counseling helps people do that.
I love that. And it actually takes me back to when I first started Journey. Tal Ben Shahar was one of our advisors, and he was Sean Akers' professor at Harvard. And we went to the World Happiness Forum, and Sean was speaking, and I had read Sean's book, and Tal introduced me to Sean. It was amazing, like just the amount of research that's now available on how to keep people happy. To your point, right? The whole Martin Seligman positive psychology is really wonderful to see, right? Not simply we're just treating things when things go wrong, but we're proactively keeping people mentally and emotionally well. And that was a lot of the foundational research for Journey of how do we proactively keep people well, both at work and at home. One thing that you and I have talked about in the past, which I think we can talk about here, is COVID, right? Like for many of us now in 2025, it feels like that was a lifetime ago, and at the same time, that was a huge shift. So I guess I'm curious, how did you see the stigma start to change during the pandemic?
It seems like people started to share with each other on the internet and in various forums that they are not okay and they're not doing well, and people started to just be much more openly talking about feeling depressed or anxious or fearful or agitated or lonely. And it was good to see people be willing to start talking about this, and they started utilizing their employee assistance programs more, looking for counseling at a time when the entire counseling and psychotherapy profession was very uneasy with the idea of virtual session, but they were forced to start to provide sessions over video conferencing platforms like the enhanced Zoom and other platforms because they had no other choice. They wouldn't be able to make a living otherwise. It was really a complete turning point for the mental health community because they were very skeptical of, could this be
Hmm.
as effective as in-person therapy? And they were delighted to find that many studies have now demonstrated that the effectiveness of virtual therapy is really parallel to in-person therapy. And I think there's still advantages to in-person, and I still think that there's some subtlety there that gets missed over video. But the field just opened up, and what happened too was that enabled clinicians to offer more availability to their clients because they were working from home or from an office where they could start earlier in the day because they didn't have to commute to an office, and they could end later. So they started offering early morning appointments and later in the evening appointments, which met the needs of the clients. And then there was a silver lining in all that for therapists because many of them during COVID gave up their offices, and then COVID ended and they're like, I don't really need an office anymore. I mean, because clients like this too. They like not driving to an appointment and parking and waiting in a waiting room and all that time, and taking a subway or whatever it is, all that time that it takes for a 50-minute appointment. It might take an hour and a half or 2 hours when you add the commuting to the office of the therapist. And so clients started to really enjoy this the convenience of video-based therapy. And so really everyone started to see how it was useful. And it's even useful in a different way. I do couples therapy, and the couple can be in two different places. Each individual can be coming on the video from two different places. We have a very productive discussion, but that might not have been able to happen if I was expecting them both to show up in an office at the same time. So it actually makes couples therapy more available to people as well.
Really interesting. I'm curious, have you seen any studies on the effectiveness of digital therapy for new patients versus existing patients? And so, what I mean by that is, if I'm working with a therapist that I've never met before and I'm meeting them for the first time digitally, I wonder what that experience is like for me in terms of clinical outcomes, et cetera, versus, like, for example, my therapist and I, we met in person when he was in Chelsea for years. Now he lives in Madrid. We obviously meet. In fact, we don't even do it on the phone on Zoom anymore. We just do it on the phone because we have years of working together. So I'm curious, have you seen any research on that? I don't know if it's out there yet.
I haven't seen research on that specific phenomenon. Most therapists do prefer to have at least an initial or one or two meetings in person with their clients if possible. But most virtual therapy these days sort of starts virtually and remains virtual the whole time.
Thanks for listening to the first half of the episode. I hope you're walking away with some valuable insights. I want to take a quick pause to tell you about my book, The Mental Health Advantage. If you found this conversation useful, you'll find 300 more pages packed with strategies, insights, and real world applications. Grab your copy on Amazon, just check the show notes for the link. And if you're looking for a more comprehensive mental health solution for your company, let's chat. You'll find another link in the show notes to reach out and explore how Journey can help you. Now back to the show. Let's transition into the importance of family care. In when you and I spoke for the Mental Health Advantage book, which thank you for your contributions to. You shared your personal story growing up with your sister. And feel free to share as much or as little as you'd like. But I think the question is, how should employers think about supporting not just the employee, but also their wider support system?
Yeah, my sister has an intellectual disability, and so I grew up with that phenomenon, and that led to some unique circumstances. There are many people in the country in the same circumstance. About 4% of the population has some kind of developmental disability, so there's a lot of siblings out there in my same situation. I think that one thing that employers recognize through having employee assistance programs and learning more about why it's important to support the family members or household members of that employee is that you are a worker and you're distressed by your adolescent son's strange behavior, or you're in a couple and you're upset or worried about your partner's decline in mental health or growing alcohol problem or whatever it is. That kind of relational issue pulls you away from being able to focus on your work. They call it presenteeism, right? You're not fully able to be there in your work mode because you are preoccupied with your personal problems that are going on. And these could be not your problems, but problems in your household member. So if you help people with their household members and you give them the support that they need, that eases the mind of the employee and can help them focus more on work and be more productive and all of that. So I think everyone kind of realizes this now, that we don't want to just help the worker. We want to help the family of the worker because it has a great impact on that employee.
For sure. You've worked with families across multiple generations. How does mental health stigma show up differently between, say, baby boomers and millennials and Gen Z, as well as, of course, Gen Xers like myself?
I'm finding with the younger generation much more open to therapy. Many of them have been in counseling or therapy in their childhood or teenage years or college years. I was at a orientation for medical residents and was really heartened by the fact that we had a table there, and people were coming over to the table and saying, I'd like counseling. I'd like to be evaluated for medication. I'm on medication already and I need a local person to prescriber to give me my psychotropic medications. And they were saying this in front of other residents. They had no qualms. They were very open about it. And I think it's wonderful. I was on a college tour with my son, Penn State, and the young woman was a sophomore doing the tour. We were walking through the campus and she's like, and here's our counseling center. I go to counseling there and a lot of my friends do too. And it's really great. College is stressful and you should think about it. Those kinds of things that we're seeing from young people are very different from, the baby boomer generation or those older generations of people who just feel that there is that stigma. The stigma has substantially lifted. There are certain cultures or backgrounds that are still a little bit more reticent than others, perhaps due to histories of maltreatment by the system in the past, kind of thing. But we're making strides with every ethnicity, with every age group. And as the younger people are coming out and starting to talk about their mental health challenges and substance use challenges, the older folks are also being impacted by that and feeling a little more open. I also think hearing like newscasters and celebrities and sports figures talk about their panic attacks or their anxiety has made a huge difference. Michael Phelps talking about his depression, and various gymnasts, Simone Biles, etc., and a tennis player, Osaka, who just are admitting that they're overwhelmed. They needed a mental health break. Those kinds of things just show people that even people at the highest levels of achievement and performance need support.
Yeah. You talked a little bit about different cultures. What have you seen companies do, or what have you seen in practice to help destigmatize things, to be able to provide support for cultures and communities that haven't historically been supported by the mental health community?
I think that the employee resource group there are various resource groups are popping up. There's Latina and African American, Caribbean American, Asian. There's all kinds of different kinds of resource groups by ethnicity, and also there's mental health resource groups now. And I think there's efforts from diversity teams across organizations to make sure that the mental health resources that are available from a corporation or a nonprofit are really made promoted amongst all these groups. And also, obviously you want, EAP professionals and the other people involved in mental health care to themselves be a diverse group of people, ethnically diverse, diverse in terms of, sexual orientation and all of that. You want to see every kind of stripe of professional that's available to show that you support diversity and want to reach out to every kind of potential audience for the mental health support.
Now, you've worked in community mental health settings and emphasized meeting people where they are. What does that look like inside an organization? How can employers adapt the best parts of community health, like accessibility and prevention and cultural relevance?
Yeah, I think about prevention and early intervention a lot, and one of the things that EAPs do and corporate and nonprofit environments do is provide psychoeducation, usually through webinars or seminars, on a variety of mental health and substance use concerns. So, you know, EAPs typically do all kinds of topics like sleep hygiene and handling stress over the holidays, your relationship with your adult son or daughter who's not thriving. There's just so many topics that are out there and available. And I think that having, mental health and relationship oriented webinars and seminars exposes people to learning and sort of sweeps people into the mental health system, which I think is really good because if you make these, people aware of what's available, people forget about their benefit packages. They forget what's in them and all the different rich resources that are available to them, oftentimes. And so you have to constantly promote the EAP and other mental health resources that you have available. If you have, meditation or mindfulness classes that are available, chair yoga, all these kinds of things that can show that you're paying attention to the mental health of your workforce, and that you want them to get help early on in the process. I also think, you and I have talked a lot about proactive approaches. I think that's a really good angle because EAPs typically are kind of a passive benefit. They just sort of wait for people to call them or contact them. They're sort of sitting there in the background and they're just sort of passively waiting. And I think another way to bring people into the mental health system is to look at sort of particular life changes that might be stressful or overwhelming to them. So people who get new promotions, people who have a new baby in the house, people who've just gone out on medical leave for either a musculoskeletal problem or depression or anxiety or whatever else, right? New hires, like everyone has a new hire orientation, but what we're doing now is contacting people 3 or 4 months after a new hire and saying, like, remember you have this benefit, and now you're starting a new job is very stressful. Developing new relationships, impressing your boss, doing this stressful work. How are you doing now? And also people in highly stressed roles. So like in the healthcare system, unfortunately, there's a lot of workplace violence. There's a lot of patient and visitor violence against staff. It's really quite bad in healthcare systems and hospital systems. And so the people who have to intervene in those situations are security personnel, right? So we're doing proactive outreach to security personnel that we know have been involved in a difficult interaction with a patient or a visitor. Could be a physical violence or verbal or whatever, but they're right in the thick of all that, right? EMS workers and other kind of highly stressed roles. There's, if you think about other industries, there's railroad conductors and airline pilots and other people in very, very high stress, air traffic controllers, right? We're thinking a lot about them these days. highly stressed roles. So push out the mental health resources to those people proactively and often. And I think that will help.
I agree completely. Um, let's, as we start to just, for the sake of time, bring this to a close. Obviously, we could probably talk about this for hours. What advice do you have for employers who want to evolve beyond surface level mental health offerings and build a system, a culture that truly supports their people?
Yeah, I mean, so you can have an EAP that has proactive elements, like we've talked about. You can have well-being coaches who are sort of focused on positive habit change. They may not be mental health clinicians; they may be nutritionists or dietitians or otherwise trained in life coaching to help people make positive habit change in their life. And it's not really around pathology like anxiety, depression. It's really like, I want to get fit, or I want to improve my sleep hygiene, or my financial wellness is terrible. I'm constantly stressed about money. I don't really understand money. How do I do that? So offering things like financial, classes or webinars to help people with that financial stress is really important. Ever more important. And there's other things like gym reimbursements that can help people. I'm a big proponent of how exercise can be have a major impact on your ability to manage stress, ward off mild depression, ward off mild anxiety, handle PTSD. Exercise is one of the number one things that anyone can do to improve their overall health, including physical and mental health. That has an incredible impact on mental health. And so, encouraging those gym memberships, encouraging discounts for gym equipment, things like that can actually help people's mental health a great deal. And then there's a lot of, we talked about ERGs. There's also a lot of peer support programs that are out there in various industries. And I hear about them from other EAPs. There are peer bulletin boards, and there are peer meetings and peer support groups around caretaking or parenting or various things, right? And I think one of the things that we were going to touch on was caretaking, and the importance of the fact that 20 to 30% of employees are in some kind of a caretaking role with their family members, and how incredibly impactful being a caregiver is in addition to working. And so any kind of caregiving support that you can give, and that could include you know, flexible schedules for people does the employer allow the person to sort of flex their schedule to get their elderly father to those doctor's appointments, kind of thing. And just sort of that compassion coming from management and leadership that we're willing to be flexible. We just get the work done. But if you need to come in late or leave early or leave in the middle of the day to do this, do it, because that's going to help the employee manage all those responsibilities of caretaking and working at the same time. Having good work-life programs for childcare and elder care and respite. If you need to find an assisted living facility for your parent, but they're only open 9 to 5. They answer the phone 9 to 5. You can't do that after work. You have to do that during work. But if you have a work-life program that can help do some of the base research, and give you, spit out, here's 5 places that kind of meet the needs, your budget, and they have availability, and they do some of the legwork for you, that can make a huge difference. Yeah.
That's great. That's great. So much wisdom, so many good ideas. Randy, I'm very grateful for you. I appreciate you making time. I appreciate you sharing all your thoughtful insights into this. Obviously, you're a pro at this, right? You've been doing this successfully at so many levels. And so thank you for the work that you do. Thank you for your passion that you bring to this. Thank you for being a champion of proactive mental health and really shifting the narrative that's out there. Your work is a reminder that mental health support has to be human-centered and inclusive and community-rooted. So I'm deeply grateful for you. For those of you listening, I hope you enjoyed this conversation. Randy, thank you again. Have a wonderful day. Thanks for spending this time with us. We know you're busy. If you enjoyed today's conversation, be sure to subscribe to the Mental Health Advantage and leave a review. Thanks so much, and have a beautiful day.